The Ghana Health Service is urging women with obstetric fistula to report to the nearest health centers to seek help. This is part of efforts to demystify the condition and repair as many as 100 cases in 100 days. The United Nations Population Fund has initiated the campaign to treat the condition, which results mainly from prolonged and obstructed labor. Those affected leak urine and feces through the vagina due to a hole created between the vagina and rectum or bladder. Director of the Family Health Division of the Ghana Health Service, Dr. Patrick Abuaje, wants pregnant women to patronize antenatal services in order to reduce the incidence of fistulas.
We have fistula in every region, and like we said, sometimes we have as many as 16 per 1,000, so that means there's a lot of women who get into this tragic situation and such a debilitating question. So it's a big problem. But of course, the greater risk are in areas where access to cesarean section and obstetric services are low. And that's why we have a higher prevalence in the three northern regions. Yeah, the most important information is that when you are pregnant, do go to antenatal care and make sure you deliver with a skilled attendant. A skilled attendant will mean a midwife or a doctor who is skilled to identify complications and refer you early. Even if you are far away from the referral center and it's identified early, your chance of getting to the next level and getting surgery done early will help. So what we are asking is for people to move to go and have delivery at the hospitals. Currently, about 80% of all our women are delivering with a skilled attendant, and so we are encouraging the rest of the 21% or so left to also join the team to go and deliver within the facility, and we'll be able to address this challenge. Also, those who have the unfortunate incident of getting fistula must avail themselves the opportunity to come for repair. There are opportunities for repair, opportunity for rehabilitation, and also making sure that you are rehabilitated back into society. So those are the two things that are important.
If you say they should avail themselves, exactly what do you mean? What should they be doing? People who have fistula?
Go to the nearest facility and you will be referred to the center where services are done. We have surgeons who are volunteered to do this for free. We organize outreach services, we group cases, they go there, spend a week plus, and do all these repairs. Are the closest to the people as possible. And so there are opportunities, despite all the challenges, that people, if they come out, we are able to address these challenges for them.
Dr. Abuaje was speaking on the sidelines of the launch of the 100 Obstetric Fistula Repairs in 100 Days initiative by the United Nations Population Fund, where Goodwill Ambassador Claudia Lumo was unveiled to champion the project.
If you go out there and you see what some of these women have to go through just carrying a beautiful, pregnancy is supposed to be beautiful. We're bringing, into this world angels. And if they have to go through all this, dying, suffering from fistula, all out as a result of carrying something that God made it beautiful, it's very sad when you come back home. So it's been something I've done, for years on my own with my foundation. And it's beautiful to partner with UNFPA to do some of the work that we do, and now to officially even make me an ambassador. I feel like it will give us the platform to even advocate more and also push policymakers to make sure they pay attention to maternal health care. I think it's hugely advocacy work, so I want to use all the platform, all the access I have, network with media, with policymakers to make sure that the right policies are being made, media making sure that people like yourselves are talking about some of the things that we want to campaign and draw attention to. We want people to know about it. People are stigmatized because of fistula when you go up north, but it's no fault of them, and these things can be fixed, but it's because people don't know about it. So we want to advocate for it, make sure the message is out there, and also try and get funds. We have over 1,000 people that suffer from fistula every year in Ghana, and it's only less than 200 that are fixed. So you can imagine the backlogs for years. So some of these are some of the things that we want media to talk about, pick it up, and also to help us raise funds to help these women.